Hello, everyone. My name is Tiara Brooks, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Enhancing Your Approach to Working with Teen Patients, Understanding Adolescent Brain Development and Nonverbal Communication Bias. During today's presentation, participants will receive training tools and resources that can be implemented in their own healthcare setting or youth-serving organization. But before we begin, we have a few housekeeping reminders. All attendees are in listen-only mode. However, we would like to hear your questions. To ask questions at any point during the presentation, please enter your questions into the chat box. It's located below in your Zoom control panel. Also, at the end of the presentation, we do have a few evaluation poll questions. Also, if you are viewing as a group, let's start to use our chat box. Please enter the name of the person that is attending and the number of people that are attending with you. For instance, Tammy Jones +3. This will help us with our final attendance count. The School-Based Health Alliance is the national voice for school-based healthcare. We support school-based health centers through technical assistance and training. We advocate for SBHCs on the federal, state, and local levels. We demonstrate the value of SBHCs with common standards, measures, data, and research. I would now like to introduce you to both of our presenters today. First, we have Lauren Rinaldi, became the director of the Adolescent Health Initiative in 2013. She has a master's in public health from the University of Michigan and a Bachelor of Arts in Psychology and Education from Washington University in St. Louis. Her previous leadership experience includes roles with federally qualified health centers and community-based organizations in Illinois and Michigan, and she previously served as Vice President of the Michigan chapter of the Society for Adolescent Health and Medicine. Our other presenter today is Asia Thompson. Asia is the program coordinator at the Adolescent Health Initiative. She has a Bachelor of Science in Community Health from Bowling Green State University and a Master's in Public Health with a focus on health, education, and promotion from the University of Toledo. She is also a certified health education specialist. Her previous work experience includes serving as health advocate for disadvantaged youth and working with interdisciplinary teams as a health, wellness, and program coordinator. I would now like to turn it over to our presenters, Lauren and Asia.
Hi, everyone. Thank you so much. I'm going to take just a second to share our screen. All right, here we go. Okay, thank you everyone for joining us today on our training on enhancing your approach to working with teens, understanding adolescent brain development and nonverbal communication bias. I'm Lauren Rinaldi.
And I'm Asia Thompson.
And we're going to take just a moment to tell you a little bit about the Adolescent Health Initiative. We are based out of the University of Michigan, but we work with a national audience of providers and healthcare professionals to provide training, technical assistance, and coaching to improve adolescent-centered care and adolescent health outcomes. So here's what you can expect from today's training. We're going to examine how to enhance your approach to working with teens by taking you through some interactive activities in the form of AHI Spark model. Next, we'll show you how you can deliver a similar training at your own clinic or organization. And finally, we're going to share some additional resources with you on providing youth-friendly services. There's going to be a lot of opportunities for interaction today, so please use your chat box when Asia and I prompt you to chime in and contribute to the discussion. So let's get started. So you just heard me mention the Spark model. So AHI developed Spark to meet the needs of health centers and youth-serving organizations that have limited time for staff training, but who are interested in improving youth-friendliness of their organization. AHI currently has a menu of 8 Spark trainings, and they're all available for you to use and download directly from our website. Each Spark comes in a version designed for clinical or a non-clinical audience, so that they can be facilitated in your own health center or organization, shared with community partners, or used for partnership building professional development opportunities. Today, we're going to show you some examples of clinical Sparks. So what exactly is a Spark? They're mini trainings that can be delivered in 15 to 30 minutes and are meant to spark reflection, conversation, and behavior change. They include ready-to-use PowerPoint presentations, scripts, and accompanying materials so that they are ready to be used and presented with very little preparation. They're typically facilitated by 1 or 2 individuals within an organization for the rest of the organization's staff. And since they're so short, they're accompanied by what we call sparklers, which are short activities that can be posted in your organization throughout the month to keep that particular topic on everyone's mind. Sparklers may be case scenarios, youth quotes, or quizzes. The content we're going to present today is actually a combination of 3 Spark trainings. We've pulled information and activities to cover topics on being an askable adult, nonverbal communication bias, and how both of those areas are related to adolescent brain development. For this Spark demonstration, Asia is going to be in the role of the facilitator, and we're going to ask that we all imagine that we're at a staff meeting together. So please use your chat feature to participate in the brief activities as if you were a participant in the meeting. So a final note, the Spark consists of a script, which Asia is mostly going to follow so that you can get a feel for it, but she's also going to provide you with some prompts and suggestions about how you might facilitate this on your own. Now I'm going to turn it over to Asia.
Thanks, Lauren. All right, guys, so today we are going to do a mini training, also called a Spark. As youth-serving professionals, it is important that we know how to effectively connect youth to services like healthcare or mental health support. In order to do this, we first need young people to be willing to open up to us about their concerns. During this Spark training, we're going to look at how we can encourage youth to seek out support from us by being an askable adult, recognizing the importance of nonverbal communication between health center staff and patients, and understanding adolescent brain development. So to get started, I want you all to think back to when you were a teenager and needed support from an adult. Who did you feel comfortable talking to? Take a moment and just get a picture of someone in your head, someone who you felt comfortable talking to as a teen. So next, I'm going to ask you all to please locate the chat box feature. I'd like you to chat in your response to the following question. What about this adult made you feel comfortable?
You didn't feel judged. The adult was approachable. They were open and understanding, non-judgmental.
They were kind. Okay, awesome.
Great. You felt comfortable talking to your gym teacher. You didn't know them well. They had your best interest in mind. They were honest. Great. Thank you.
Thank you. Those are all great examples. Thanks for sharing. All of these characteristics are really important to keep in mind when working with adolescents. So now we're going to review some tips about how to be askable. The first 2 tips are to convey warmth through body language and use a non-judgmental tone of voice. Next is to ask open-ended questions and practice active and reflective listening. This means paying close attention to what someone says, including their tone of voice and body language, and to repeat back what they say to ensure we understood them correctly. To be askable, it is also important to avoid making assumptions. To be askable, one may also give affirmations and avoid criticizing or shaming youth. Askable adults keep conversations focused on the adolescent. They provide clear information and avoid giving opinions. Finally, they discuss confidentiality so the young person they're speaking with knows what kind of information will and will not be kept private. Let's take a few minutes to think about how we can become more askable. When we look at the tips that we've just reviewed, it may be easy to think we all do all of these things very well. However, it is unlikely that we appear askable to youth all of the time, especially when we are feeling tired, stressed, or in a hurry. So let's move into another chat discussion. Please locate the chat box feature on your dashboard and answer the following question. When you are feeling tired, stressed, or in a hurry, in what ways might you appear unaskable to youth? So go ahead and chat us over some of the ways you think you may appear unaskable to youth in certain situations.
Hiding in my office, closed off body language, Little eye contact, looking distracted.
Facial expression.
Flat or grouchy affect might interrupt them. I have a resting angry face. Yep, we might all kind of just appear hurried. We might actually be in a hurry. Great, thank you.
Great.
Sound anxious, can't focus on the conversation. Yep, not really listening, kind of short answers. Looks like their need isn't very important. Yep, these are all great examples. No eye contact. Excellent, thank you.
Thanks for your responses. So now we have a second question. So thinking about all of those things that you just listed about how you may appear unaskable to you, think about how in these moments, how you can be more askable. What are some of the ways that you can kind of, make you feel more comfortable in those situations?
Telling them that their concern is important, being more present. Look up and give a verbal response. Take a deep breath, focus on their needs. Stop and put down what I'm doing, slow down, talk to them face to face, nod, actively listen. Right, all of these are ways that you can not only appear more engaged, but actually become more engaged if you're in a hurry.
Great. All right, thanks for sharing. One of the biggest ways that we can be responsive to the needs of teen patients is through communication, both in how we communicate messages to patients and how we perceive the messages that we get from patients. To start off, we're going to concentrate on messages that teens convey and how we might perceive them, and focus on nonverbal communication only, like appearance and body language. It's natural for people to have first impressions based on others' appearances and body language. That is not necessarily a bad thing. For instance, picking up on nonverbal messages can help us notice if a patient looks distressed. Still, it can be tricky to think and talk about how people make judgments. However, noticing these judgments allows us to be more aware of our own reactions. Also, we know all teens are different, and there are many different communication styles among them. But there are some powerful stereotypes in the media and in our culture that can influence how we perceive teens and young adults. And it can help us to think about how these play out in a clinical setting. A recent study done by the University of Michigan found that adolescent girls who are obese are less likely to prevent pregnancy by using contraception than girls in a lower rate range, even though they both have similar rates of sexual activity. The researchers who did the study raised the question, could providers talk about contraception with obese teens less often? Take a moment and reflect on this. How likely do you think this is? Also, consider other ways that providers' perceptions of teens may affect how they talk to them about sensitive topics like sexual health. Adolescents make up the biggest group of new sexually transmitted infections. However, many providers don't address sexual health with adolescent patients. One study found that in 1/3 of adolescent well visits, the provider did not talk about sexual health at all, and on average, those who did talked about sexual health for 36 seconds. Why do you think this is? Do you think that some providers would be more likely to bring up sexual health with different populations of teens? If so, do you think that they would be aware of it? We know that most of us try our best to be non-judgmental, but it's natural to have some bias. Bias is a form of judgment based on our opinions. Our opinions are often influenced by messages in our culture, like stereotypes. These messages are often so deeply embedded in our minds that we are not aware of them, which is why they're referred to as unconscious biases. We're going to look at a few slides and try to imagine how unconscious bias might play out in a clinical setting for various roles of staff and providers. We know that we can't really say for sure whether or not people would show bias, as there are many factors. And this is unconscious bias we're talking about. So the whole point is that we're not usually aware of it, and we don't do it on purpose. Each slide will pose a question. There's no right or wrong answer. The point is to consider if people might have biases around certain issues. We're not going to answer the questions aloud, but think to yourself about your reactions, if you have any. Who might people be more likely to have concerns about drug use? Who might people be more likely to make a negative comment to if this person was late for an appointment? Who might people be more likely to have concerns about depression? Who might people be more likely to offer insurance or payment options to? The point of this activity is not to suggest that any types of teens are more likely to be a certain way than others. We probably had different answers for different reasons. Some may have felt no response. Also, when people think about the reasons they might be more sympathetic with a patient, some say they are more likely to help people who we think need help more or who we identify with. Hopefully, reflecting on people's first impressions helped us think about some of the ways that we might perceive teens' nonverbal messages and what we can do about it. In a clinical setting, our first impression of a patient is usually based on nonverbal cues and the moments before we interact with them. Let's look at some of the forms of nonverbal messages and think about what teens might convey. Facial expressions could be positive and open, or could convey fear, reluctance to talk, or anger. Eye contact. Some teens avoid eye contact or roll their eyes. Personal space might look like someone getting too close, or withdrawing or pulling back. Hand gestures and posture can convey many things. Many people often think crossing arms conveys disapproval or a standoffish tone, but there could be another explanation. It's common to make assumptions about communication cues. This can show us when we have biases. So let's switch gears. How do we send messages through nonverbal communication, whether we mean to or not? One of the interesting things that we've learned about teen brain development is that in general, they don't always interpret facial expressions the same way adults do. In one study, teens and adults were shown pictures of facial expressions and asked to identify the expression. Adults consistently identified the emotion of these two photos as fear, and teens identified them as shock or anger. Teens can be sensitive about perceiving criticism too. Parents of teens sometimes say that teens say, "Stop yelling at me," when the parent isn't raising their voice. While we can't control exactly how anyone interprets our expressions, we can keep in mind that it's especially important to be clear, warm, and open, both verbally and non-verbally, when we are trying to help teens feel welcome. Let's look at some slides to imagine a teen patient's point of view. After all 4 of the slides, we'll discuss our responses. You are a teen and you're running late for your appointment. You walk up to the front desk and see this person. How do you feel? Okay, so please chat us over your perception of this nonverbal communication cue. So if you were a teen and you walked up to your doctor's appointment and you saw this lady where the arrow is pointing, tell us what your perception of this nonverbal cue would be.
Something not interested, you might feel insignificant, that they're bored. You might feel unimportant. She's bored. She doesn't have much to do. You might feel like you don't matter to the people at the clinic, that they're uninterested in you. They don't want to be bothered. Meh, disinterested. Not important or irritated.
Yeah, an interesting response that has come out of this Spark is that some people thought, well, I'm running behind, but she doesn't seem too worried about me being late. Like, maybe it's okay that I'm late because it looks like she's not really doing much or she's not really like waiting on me. So that was like an interesting perception to have about this particular cue. So thanks for sharing. So let's try one more. So what about this one? You walked up to the front desk and you saw this lady waiting for you and you were late. How would it make you feel as a teen?
Whatever. Annoyed. She's annoyed by me, feel judged, scared. She's fed up with patients. I'd want to turn around, right? You might think that this is not a place where you want to get services. She's disappointed. She doesn't care. Might feel like you messed up. You're in trouble. Yep, feel like I totally screwed up.
Right.
A lot of judgment that we're hearing here. Feel like you need to walk on eggshells. You might be less open to expressing concerns or needs that you have up front, right? If you feel like you're sort of already in the hole.
Yeah, or if you're feeling uncomfortable discussing something with your provider in the first place, and then you show up and you feel like you've messed up, it might make you less open to want to discuss those important things. Great, thank you guys for sharing. So now we're going to look at one more round of slides with providers' expressions. You are a teen and have just disclosed that you have had multiple partners. This is the expression of your provider. How do you feel?
Take a moment just to look at these next few photos.
Again, we might have different interpretations, but what might this communication cue get across? So let us know how this cue would make you feel after you share that with your provider. Concerned, but open to listen. That's important.
Provider might be worried, feeling with some sympathy, concerned, maybe a little disappointed. Might feel that she's a good listener. She's concerned about you. It's not negative. She's being good and open. You might feel pitied, non-judgmental. So it's interesting because people have a kind of a range of responses to this, right? So I think it sort of illustrates the point that what we are expressing can be read in multiple ways, right? Some people feel like she's feeling present. Some people think she feels badly for me because I've done something wrong, perhaps. A lot of different ways to sort of read this facial expression. Great, thank you.
All right, so let's try one more. Let us know what your response would be to this expression from your provider.
She looks shocked or surprised, feeling judged. You're kidding, right? Yep, that's judgment. She's going to tell my parents. She's concerned about what you just said, surprised.
All right, great. All great responses. Thank you for sharing. It might be challenging sometimes to keep a neutral or non-judgmental expression, but if we want to keep them coming back, and for providers, if we want them to consider behavior change, we need to watch our expressions with our teen patients closely. Adolescence is an essential stage of life, and its developmental characteristics are a natural part of the way the brain is changing. Even if we know that teens will be teens, and adolescence is an important phase of development, it can still be challenging to work with teens. Some people love working with them, some don't. Either way, understanding what's going on for them can help us be respectful and give them the care they need so that they will keep coming back to us for their care.
And one of the things that Asia just mentioned about how some people love working with teens and some people don't, that's something that we hear consistently, kind of across the country and with the healthcare professionals that we work with, is that we sometimes hear from pediatricians that they didn't necessarily get into their field to work with teens. And we sometimes hear from family medicine providers the same thing. And we certainly, we haven't often heard from people, I became a front desk clerk or I became a medical assistant because I love working with teens. And they can sometimes be a forgotten population. you're absolutely going to have people out there, I'm assuming many of you, who feel really passionately about this population. But it's really important to think about and keep in mind the sort of makeup of the staffing at your clinic or at your organization, and where certain people sort of feel passionately and kind of what populations they're most interested in working with, knowing that they're still going to be working with your teen patients.
Okay, so now we want to hear more about the interactions you have with adolescents. Let's move into another chat box discussion. What are some of the adolescent behaviors or characteristics that you experience that can be seen as positive? So in your day-to-day work or any kind of interaction you have with adolescents, let's list off some of the behaviors that you see as positive with teens.
Smile and have eye contact. They're curious. What else? There's some of the positive behaviors or characteristics. Yep, they ask how you're doing. They care about helping those they're concerned for. They ask for your opinion. They engage in discussions. They have a good sense of humor. They're open to LGBTQA individuals. Nothing shocks them. They're more independent. They're often interested and curious. They can be bold and fearless. Inclusive behavior. They can make their own food. You like when they ask questions. Yeah, they're listening even if you don't notice that they're listening. Great, these are all good ideas and suggestions. Respectful. Go out of the way to be helpful.
Outspoken.
Yep, outspoken can be positive.
Yeah.
Enthusiastic. Thank you.
Great, thanks. These are all very common behaviors that we hear from people about the, the positive behaviors that they notice when working with teens. But on the other side of this question, let's reflect on what could be seen as a frustrating characteristic of working with teens. So we got all the great stuff out the way. Now let's talk about what might frustrate us about teen behaviors.
The sort of, it's fine response. Defiance. Won't take their earbuds out to listen. They often look angry. They're on their phones when you're speaking to them. Sometimes, yep, they're pushing rules or boundaries just to see if they can. Kind of nonverbal, sort of whatever. Believing that they're not vulnerable, that may be invincible, that everything feels incredibly serious.
Not engaging, defiant.
Yeah, lack of eye contact, maybe slamming doors, don't want to talk to you at all. They get angry or frustrated. Great, thank you.
Thanks for sharing.
Emotional roller coasters.
Okay, so for our next prompt, just take a moment and reflect on it in your mind. You don't need to type anything into the chat box, but just think about some adolescent behaviors or characteristics that you notice most in a clinical setting. So just think of a few, the ones that you notice the most often when working with teens. So out of the behaviors that you've reflected on, go ahead and type in the chat box the behaviors that you find the most challenging. What are some of the most challenging characteristics for you personally, like in your day-to-day work, challenging behaviors when working with teens?
Okay. Disengagement, not willing to talk. Sarcasm. Not putting the phone down. Might express anger. Let's get a few more. Not engaging. And they're so frustrated, they just see everything is bad. Texting while you talk. They feel like they're in a rush, not making eye contact. Their attempt to be invisible when you're in their presence or out in public. Yep, those all do sound like challenges. They kind of know it all, or they're just interested in change. Great, thank you.
Thanks. And now let's talk about the rewarding behaviors. What are some of the teen behaviors that make your day, that make you feel like you've really gotten through to working with one of your teen patients.
They're thankful and asking thoughtful questions. Yeah, when they thank you for something, it feels good to be appreciated. Following through on the goals that you've set, you want to be in the group. Yeah, when you can see the real smile, right? Their energy. What else? Get a couple more.
When you feel included, when they're teachable and open to dialogue, when they come back, that's important, right? That's a great sign when you can tell you've gotten through to them when they're coming back for more. Stop by to catch up when they're not in class, excited to take on new challenges, tracking change and goals, and coming to follow-up appointments. Remembering something that you said to them at the last visit. Okay, another one, when they bring up something you taught or discussed a while ago. That has to feel very rewarding, right? Great. Thanks so much for sharing, guys. These are all great reflections to keep in mind about the adolescent behaviors we notice in our clinical settings that affect our day-to-day work. Functional MRI has shown us how the brain develops from age 5 to age 20. There are significant changes that occur during the period of adolescence, with some parts, like the prefrontal cortex, not fully maturing until the mid-20s. In the front of the brain is the prefrontal cortex, which is the part that controls complex decision-making, judgment, and understanding cause and effect. At the same time that the prefrontal cortex is developing, the limbic system, which is in the middle of the brain, is highly active. That is the reward center and controls emotion. As part of their development, many adolescents crave novelty and seek new experiences. The combination of these developmental characteristics can result in behaviors that can be really challenging for both adults and teens. Also, the need for peer acceptance is at its peak, and many teens seek excitement through risk behaviors. Sometimes they don't always have an accurate perception of the consequences of their behaviors, like using alcohol, drugs, and having unprotected sex. Also, most teens are focused more on themselves and their personal needs than they are on others. These are all normal and developmentally appropriate when we consider the way the brain is changing during adolescence. It can be hard to remember that this process is normal for teens. When a toddler has a tantrum, our first reaction might be irritation, but usually our adult brain kicks in and reminds us that they are probably hungry or they just need a nap. And this behavior is normal for a child. Often though, when we interact with teens and see negative behaviors that can be challenging or annoying, we forget the developmental explanation for these behaviors. Considering this, what can we do to adjust our behaviors or reactions to give teens the patience and respect that they need? It's up to us as adults to help them along the way, and it's what we have to do to be truly patient-centered. To help us think about what this means in our day-to-day work, here's a scenario that may seem familiar. You work at the front desk. 16-year-old Shayla is 10 minutes late for her appointment, and she comes up to the front desk to check in. She does not look up at you, but instead, she stands at the desk and appears to be texting. In an upbeat voice, you say, "Hello, do you have an appointment?" She continues to look at her phone, frowns, and keeps texting while you wait. Finally, she looks up and says, "What?" Consider your gut response to this situation. Let's break down this scenario to think more specifically about how we can adjust our reactions to give teens the patience and respect they need. First, let's revisit Shayla's scenario on the screen together. Here in the first column is the scenario description. To summarize, Shayla was late to her appointment and then was texting while the receptionist was asking her if she had an appointment. So let's move to the next column. Think about what your gut reaction to this might be. Some of your thoughts may have included feeling annoyed or mad. Next, think about what negative assumptions you may have. Sometimes, without consciously thinking about it, we create a quick story in our heads about why someone is behaving a certain way. In this case, we might think to ourselves, I bet she's texting a friend about something unimportant, and she's rude to ignore me. Here's where we need to rewrite the story and imagine other possible reasons Shayla is behaving as she is. One possibility is that she was late because she had to take a bus to get here, and the bus was running late. When she walked to the front desk, she frowned when she got a text from her mother saying that she needed to get home as soon as possible to watch her younger brother. Developmentally, she might be tuned into her own needs more than the receptionist. So she is distracted by her text and doesn't reply right away. Now, this situation still might be frustrating, and the text could also have really been about something trivial from a friend. But it can help us give teens the benefit of the doubt and not let our gut feeling control our reaction to the teen. So let's close with some discussion about another scenario. I'd like for everyone to locate the question box again on your webinar dashboard. First, I'm going to read the scenario. Next, I'd like for everyone to type their gut feelings to the scenario in the chat box. Darren's wearing saggy pants, and his shirt says, "Please tell your boobs to stop staring at my eyes." His mother is standing next to him. When you ask him a question, he shrugs and grunts. His mother says, "Darren, they're talking to you. Speak up." Then she turns to you and says, "Can you please tell my son that he needs to answer you and respect adults?" So chat us over what your initial gut feelings to being in this reaction might be, being in this scenario might be.
Yep, it could be a sort of normal teen behavior. They're withdrawing. What else might you feel? Annoyed with both of them, right? She shamed her child in front of me. It might make me uncomfortable. Parenting is your job, not my job. A little overwhelmed on who to assist first, the parents or the teen.
Mom is passive. She feels unable to make changes herself. Annoyed with mom. You might feel like you need to talk with him alone, right, without mom around.
Yep, teens that often have difficulty with all adults, and mom is automatically putting you in the same position. Great, thank you. Where can I get the shirt?
Okay, great. Now let's move on to what some possible negative assumptions from this situation may be. So after being in a situation like this, what are some negative assumptions you might make about Darren or even his mom?
Here's some of the negative things you might assume, right? He doesn't want to be there. Mom and the son don't have good communication. She's got no control over her son's behavior. They're both annoyed. Mom is enabling her son to be disrespectful. Darren doesn't respect mom and does not respect other adults. Yep, he's got history of being disrespectful. Yeah, these are all things, all negative things that we might assume about this scenario.
Great, thank you. All right, lastly, let's think about how we can rewrite this story and think about some other reasons why Darren or even his mom might be behaving this way. So go ahead and chat us over some alternative explanations to this scenario.
He's uncomfortable around adults. Yep. Darren and his mom had a fight on the way there. He's feeling isolated, isolating himself. He's scared and he doesn't know what to do or how to communicate, right? We're not sure what kind of appointment he's coming in for. That mom's trying to teach them to tend to his own business. Maybe they're both going through hard times in other areas of the life. Maybe the doctor's visit just doesn't seem like an important thing to be doing today. Maybe he needs privacy from his mom.
Darren doesn't feel heard by his mom. He responds to adults negatively. Mom and Darren just had an argument in the car. He's frustrated by her, not by being there, right? May have had something else planned he would really rather be doing. Mom has not given him opportunity to learn to positively interact with adults. Communication goes both ways, yes.
One response we heard recently with this spark was that maybe he has no other clean clothes and he feels a little embarrassed about what he's wearing or how he looks right then.
Great.
Thank you.
Thank you. Well, hopefully today's discussion has sparked some ideas on how we can all be more patient-centered with our teen patients and meet their developmental needs. To keep this conversation going, I will share sparklers or case scenarios that relate to adolescent brain development, being an affable adult, and nonverbal communication bias. I'll post the sparklers around the office in places that you can all easily see them. When you see a sparkler, take a moment to read the scenario and think through the questions listed on the page. Thank you all for your participation.
Great. So now that we've modeled a spark for you, we're going to spend a few minutes diving into the model. So all sparks follow the same outline. The hook is what emotionally draws someone into the topic. Key concepts introduce the content, and the application and sparklers give participants ideas on how to put what they've learned into action and keep the conversation going. So as a reminder, AGE has just combined 3 different spark trainings today, but on our website, you can access the full versions of being an affable adult, nonverbal communication bias, and adolescent brain development. Each have their own scripts and case scenarios, content, sparklers. Some of them have some videos as well as some additional research kind of behind the content. So now that you know what sparks are, we're going to talk a little bit about how you could effectively deliver one in your organization. So the good thing is you don't need to be a seasoned public speaker or content expert to deliver a spark. What you do need to be is a facilitator. So using the chat feature, can anyone share qualities that, what do you think makes for an effective facilitator? Able to grab attention? Oh, energetic, right? Gotta have some energy in the room. Good listener. Using their hands, maybe gesturing, being engaging. Ability to ask questions based on feedback you're getting, including everyone who's there, open to others. Yep, giving lots of people opportunities to talk, not just relying on a PowerPoint, being organized, staying neutral. Yep, giving work back to the participants. Yeah, these are all great. I would add to that, I would say, maybe, making sure you're being sensitive to time, watching the schedule. I was just about to say sense of humor, and then somebody typed it in. Being, prepared, right? Having all of your stuff in order, ready to go. Excellent. Yep. How they dress, being culturally competent. All of these are important things to remember. Great. So as you can see on this slide, to facilitate means to make easier, meaning we create a safe and supportive space for people to work together and learn by providing a structure for learning. A facilitator is a person who effectively and efficiently guides without directing, brings about change without disruption, and assists people and groups in constructing their own learning. So sparks are designed to be delivered by a facilitator rather than a presenter. And they're supposed to be conversational and spark dialogue rather than being focused on transferring really, in-depth knowledge from the presenter to the audience. So keep that in mind as we continue. We're going to spend just a minute thinking about 5 adult learning principles. So those are that adult learners need to know what they need to know. That as adult learners, we have a deep need to be self-directing. We have a deep reservoir of our own experiences that's a rich resource for learning, both for ourselves and for others. Adult learners become motivated to learn something when they experience the need to learn it in order to cope with real-life needs, interests, or problems. And they attach more meaning to learnings they gain from the experience than those they acquire passively. They prefer problem-solving over subject-centered learning. So quickly, using the chat feature, type in 1 or 2 of the numbers that really resonates with you as a learner. So number 1, number 3, you know, which one of these actually do you kind of see for yourself when you're learning something new? Number 5, yep, if you've got your own experiences. Number 4, you're more motivated to learn something if it really relates to, you know, something that's happening right now. Yep, we're seeing a lot of number 4s. Number 1. Number 4 is the clear winner in this group. Yep, and I agree. I think number 4, and for me, number 4 and number 5 are the ones that kind of speak to me the most. So thank you. So this is just to say that when you're facilitating a Spark or any kind of training or professional development opportunity, think about which of these principles might also resonate with your staff or your coworkers, and how you can use them to effectively provide professional development opportunities. Some examples might include providing background or rationale on the topic, including interactive conversation prompts, or having opportunities for participants to share their own experiences and expertise. So when you download a Spark from AHI's website, which are free and ready to use, you'll get the PowerPoint slide, the facilitator script, the participant handouts, and the Sparklers, which are those follow-up activities that can be shared throughout the month. So in this slide, we have a portion of a Spark script, and at the top, you'll see that it shows you the supplies you need, which often just includes like a projector, a laptop, speakers, copies of any of the handouts. We just want you to feel prepared. You'll see the script clearly notifies you when to switch slides on using the computer icon and the slide title. And Sparks they're already written in a conversational tone. Occasionally, though, you'll see blue text providing a facilitator with instructions or prompting you to maybe include some personal stories if you feel comfortable. The goal of the script is to make it as easy to use as possible, requiring very little preparation time. One thing I heard recently from someone at the Alabama campaign to prevent teen pregnancy was, I found your Sparks last night and I used them in my staff meeting this morning. And that's exactly what we want. They're meant to be that easy to use. And this is just an example of one of the Sparklers. So it's another case study or scenario that you could post in a break room or in the lunch area, anywhere where it might just help spark conversation to keep going on the topic. So now that you know the background for the model, and you've kind of seen one in action, a modified version, we would suggest, you know, take a moment to review the topics that are on our website and see what might be a good fit in your community. In addition to the 3 Sparks that we showed today, we have Sparks on being youth-friendly, confidentiality best practices, strengths-based approaches to adolescent sexual health, cultural responsiveness, school referrals, and other topics. And they're all readily available for you to use on AHI's website. So next, think about your setting. They can be facilitated in a health center with the entire practice team, anyone from the front desk staff, medical assistants, social workers, physicians, security guard, anyone who's going to interact with your teen patients. But they can also be used for professional development opportunities with community partners. You could share the format with them or offer to facilitate a Spark in their setting. We've even helped organizations host Spark train-the-trainer sessions for partners in their community. And just feel free to connect with us after this webinar if you've got questions or ideas. And, you know, try one out and let us know how it goes. We're always happy to hear from people across the country who have had experiences, you know, adapting them for their setting. So now that we've kind of presented the content for today, we just want to take a quick moment to tell you about other resources that we've developed, all toward the goal of improving adolescent-centered care. So starter guides are mini toolkits that offer concrete, actionable steps to improve adolescent-centered care. We have 9 guides available, including topics like improving well-child visit rates, increasing chlamydia screening or HPV vaccination, establishing or enhancing collaborations between primary care providers and school-based health centers, and a number of other topics. And again, these are just easy to download right from our site. For health centers, we've also created a number of resources that help providers and staff understand the principles of adolescent-centered care, as well as posters that provide visual cues to patients that adolescents are a welcome and valued population. You see an example of one of those posters here on your slide. AHI's Teen Advisory Council has created a number of youth-driven videos for providers, patients, and parents, including topics such as teen self-advocacy, being your own healthcare advocate, voices of transgender adolescents in healthcare, and a video for parents on transition called Take the First Step Out of the Exam Room. All of the videos are ready to use and download on our site. Adolescent Health Initiative also provides technical assistance, coaching, and consulting on a number of different topics. So if you have a need in your community, please feel free to reach out to us, and we hope you'll take advantage of these resources. Finally, we have a number of tools available for health centers to assess the adolescent friendliness of their sites. So these range from simple checklists, youth-led assessment processes, to our more in-depth quality improvement initiatives to help health centers become certified adolescent-centered environments. So we've implemented this certification process with primary care and school-based health centers in 13 states, the most recent of which are the ones highlighted in light blue. But you can feel free to reach out to us after this webinar if you're interested in learning more. And lastly, I wanted to let everyone know that about the 2018 Conference on Adolescent Health. Registration is actually closing this Friday, April 6th. This is an annual event that draws physicians, nurses, social workers, researchers, students, and public health professionals from across the country. One of my favorite things about the event is that about half of the sessions at the conference are co-facilitated by youth collaborators, which provides real-time perspectives from youth on how providers and health professionals can help improve adolescent-centered practices. So again, registration is closing on Friday, so you've got a few more days to reserve your spot. It's a really incredible event, and we're doing some great things for the kind of 5th annual celebration this year. So I hope you can join us in Michigan in a few weeks. So thank you so much for participating in today's training. Feel free to reach out to us for additional support, and I'm going to hand it back over to the School-Based Health Alliance staff for sort of wrap up and questions.
Thank you very much. Now, if you would please enter any questions that you may have into the chat box. We'd now like to give everyone an opportunity. But while you are entering your questions, we would like to just have a couple of announcements. We ask that you join us by becoming a member. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. Please take a moment after the presentation to visit our website at www.sbhforall.org/membership for more information and to join. Also, I now would like to talk about our 2018 National Convention. Please join us for our 2018 National Convention in Indianapolis, Indiana. As the premier national gathering for our field, the convention is a fantastic opportunity to connect with hundreds of fellow school-based healthcare professionals and advocates from across the nation. Once again, please visit our website at sbhforall.org/convention. Now I will refer to our chat box and we'll see if anyone has any questions. All right, so we have our first question is, are there Spark trainings for professionals that work with teen parents?
Yes, we don't have one currently developed specifically on working with teen parents, but there's a lot of topics that are available that would apply to adolescents who are parents themselves. So I would encourage you to take a look at the menu, and we're always developing more. So if there's specific content area you're interested in, please let us know.
All right, thank you very much. What has been done if a patient refuses to speak?
So I'm not sure if I completely understand the question. Are you talking, if maybe you're asking about strategies for getting patients to speak? And so I think go ahead.
No, I'm sorry, that's a very good question. I was going to say if they can include that into the chat box just so we can get a little clarity on your question.
So maybe while you're doing that, the next question is about the website. And actually, yes, we changed our web address, but both will take you to the same place. It will reroute you. So adolescenthealthinitiative.org or the UMHS address. Okay,
yes, and just referring back to the other question, they included strategies in order for them to open up.
Mm-hmm. Yeah, so I think I think part of it may depend on the role. If you are a medical assistant or if you are social work or front desk staff, certainly strategies in terms of motivational interviewing techniques, opportunities to make sure that you are doing confidential time alone with the patient. We do have a guide on sort of how to integrate risk screening and confidential time into the workflow so that you have opportunities to talk one-on-one with the patient. Strategies around improving the dialogue when you do have a parent in the room. So for the sake of time, I think I would say I would encourage you to, if you aren't familiar with motivational interviewing, that would be one great thing, but also kind of take a look on our website or on the School-Based Health Alliance website or Healthy Teen Network or others to sort of look at opportunities for how to engage with patients. And some of that might be also thinking through some of the things we talked about today in terms of what messages are you conveying to patients. If they're not opening up, is there something that you could sort of look at about yourself to say, what is my presence like right now? What is my body language like? And maybe I'm not positioning myself to be a person they want to open up to.
Okay, great. Thank you so much. We also have a comment about more content possibly on the site for immigrant and refugee friendly. Is there any thing on the website that you can kind of direct them to?
So we do have, one of our trainings is around cultural responsiveness, and it really looks at sort of different opportunities to provide culturally relevant care. And it's a content area that we're kind of further developing right now in terms of immigrant and refugees. If anyone has any specific resources that you think would be great to feature on the website, please feel free to email us. But I appreciate the feedback.
Okay, great. And we'll also include your emails in the follow-up email that we send to all of our registrants too, if that's okay, in case they wanted to follow up with you.
Yes, please, please.
Okay, perfect. Our next question is, do you have trainings on Johari's window?
We do not. It's not something I'm personally familiar with, but if you want to send some information, I'm happy to take a look.
Okay, we'll give others just another minute. If you have any questions, just let us know. And we do have another announcement. While we're giving others one more chance, for our Be the Change Youth program, they will also be, of course, at our convention in 2018. If you want to know more about our youth program, please visit our website. Registration is open to all youth ages 14 to 18. And there's also a scholarship for this program. So once again, if you can please visit our website for additional information at sbhforall.org. Okay, is there any other final thoughts you would like to add, Lauren or Asia, before we start our poll questions, or any other information that you may want to add before we conclude? Oh, I'm sorry. There is another question that just came in really quickly. Any training for how to speak with a suicidal teenager?
So right now, what we have information available on when you're conducting risk screening and conversations to have around identifying risk. And this is actually a topic. We have a grant right now to develop more resources around specific risks that are identified, including suicide. So please check back again in a few months, because we will have a lot more in this area coming very soon.
All right, thank you. And we'll also include a link in our follow-up email regarding Johari's window that's been submitted to us. And we appreciate that. Thank you very much. Okay, Lauren and Asia, is there anything else you would like to add?
No, thank you. And like I said, our contact information will be available. So if you do have other questions or you want specific information, about resources that are available, please don't hesitate to reach out. And thank you so much for being such an engaged group today.
Yes, thank you for your participation.
Thank you. And now we would like to appreciate if you guys can complete 4 evaluation poll questions for us and just provide us some feedback. Your feedback is very vital to help us to do more presentations like this to meet your needs. And we'll give everyone just a couple of minutes. Thank you. Okay, and just one more minute. So the questions are, did this presentation meet your needs? How likely are you to apply this information from this presentation in your organization? How well did the presentation meet the stated objectives? And would you recommend this webinar to others? Okay, again, thank you everyone for attending today's webinar, and to our wonderful presenters, Lauren and Asia. We again thank you for this great information. We will send everyone a follow-up email, and this webinar will be available to all of our registrants in 3 to 5 business days. Again, thank you and have a wonderful day.